Introduce our first panelist. Jamie Harvey is the Executive Director of the Institute for a Sustainable Future, a Duluth, Minnesota-based not-for-profit organization where he directed Healthcare Without Harm's Healthy Food and Healthcare initiative. Along with a team of colleagues, he is developing a regenerative healthcare network, exploring the intersection of regenerative healthcare design and prevention-focused healthcare. Jamie coordinated Healthcare Without Harm's successful mercury elimination campaign, leading negotiations with the top U.S. retailers to voluntarily eliminate the sale of mercury thermometers, and coordinated the introduction of mercury legislation across the United States. He speaks internationally on ecological health issues. His organization won a Minnesota Governor's Award for his work on healthy food and healthcare, and he was recognized as a national thought leader for his work on healthcare and sustainable food systems by the Natural Resources Defense Council. Mr. Harvey has consulted on pollution prevention for clients including the state of Minnesota and the Chinese Environmental Protection Agency. And most relevant to today's discussion, he serves on the steering committee for the Green Guide for Healthcare, the healthcare sector's only quantifiable sustainable design and operations toolkit. So, Jamie, take it away.
Thanks so much, Jeff. Let's see. There we go. Just a big welcome to everyone, and thanks for coming to listen to this conversation about the Green Guide for Healthcare. And while we're going to be framing the conversation around healthcare, really the takeaway message and why I was excited to do this presentation was to put an institutional frame on this conversation, in that though we're talking about healthcare, these Green Guide credits I'm going to share, and that the following presenter, Nicole Copen from Oregon Science and Health University Medical Center, will explain. These are credits that can be used really in any institutional food service operation. So to start, what is the Green Guide for Healthcare? And I have to give you a little bit of history to hopefully avoid some potential confusion. In that, when the Green Guide was first developed as a self-certifying toolkit, it was developed to steer the design and construction of hospitals. And it wasn't focused on operations. So the earlier versions, version 1 and version 2, released early in the 2003, were focused on construction. But for the purposes of this call and for this audience, I'm going to focus on our food credits, which are part of the operations section that was launched in 2009. Both the construction and operation guidance of the Green Guide were based on sort of some foundational principles that were promulgated by the American Society for Healthcare Engineers, which really wanted to focus, when thinking about healthcare, on protecting the health of the building occupants, the health of communities, and the health of the global community. So really consistent with the Good Food Networks and thinking about healthy, green, fair, and affordable. So I'll be talking about the Green Guide credits. Often they're referred to as points. And if the audience is familiar with the U.S. Green Building Council, that has a series of points, the lead rating system, the Green Guide is actually modeled after this rating system, but was originally designed for the specific needs of healthcare. So each of the points or credits in the Green Guide have a specific intent. They highlight specific health issues, they share credit goals, provide some required documentation and reference standards. So as you become familiar with these, perhaps after the call, you're able to get a better understanding of this framework and see how they're organized and relate to one another. The Green Guide, when it was first launched, I think the audience should understand that there was really no guidance for healthcare, and they're quite widely adopted. This is a slide, an older slide from 2008, but you can see that the Green Guide, there was a significant uptake not only in our country, but across North America and the globe. That's just a little background. So as I indicated, the Green Guide has a construction section, which is, you can see some of these which make sense if you're imagining design of buildings, sustainable sites, water efficiency, energy and atmosphere, and so forth. But as I indicated, the purpose of this call is to really focus on the food service credits within the operations section. And part of the history and rationale for including food credits into the Green Guide was that in our work with hospitals over the last 6 or 7 years, and again, not dissimilar from the work that others are likely doing in other institutions, college campuses, schools, and so forth, was that there's really little transparency in the supply chain. So in a hospital, for example, you might be able to get 2-ounce, 4-ounce skinless chicken breasts, Thai chicken breasts, fajita chicken breasts, but you have no idea where they're produced, how they're produced, and so forth. As well, there was a need for objective criteria to measure and benchmark because we had quite a significant uptake by hospitals interested in changing their procurement, but they really didn't know how to measure, how to benchmark progress. And for those that were on the leading edge, they really wanted to be able to track and plan. And Ecole's presentation after mine is a perfect example of the type of leadership that we're seeing in hospitals. And then finally, there was really no institutional food system framework for thinking about food service operations. Typically, it was from a strictly nutritional perspective. So in putting together these food credits, we wanted to frame institutional food system in a sustainable frame, or we could call it a good food frame, so that we can think about all the components of a food system and how consumers in those institutions can be educated and how they can change and influence the food service operations. So what I'm going to do now is do a quick overview of some of these credits. So I'm going to delve into this food service section of the operations section of the Green Guide for Healthcare. So hopefully folks are still with me, and we'll move into a couple of examples. So specific to the food service credits, we have 8 different credits. As you can see, they talk about a food system policy and plan, nutrition credits, food education and promotion, because we recognize how important it is at the point of purchase to educate consumers, but also to educate the employees as to why an institution might be taking on a good food approach to their procurement and food service and so forth. So I'm going to run through a couple of these examples. I think what's going to happen is that Ecole is going to do a nice job of delving in and sharing how her institution has been able to use this food system or good food framework of credits to advance their institutional procurement. To start, we recognize that we wanted any institution, or in this case our hospitals, to understand the rationale behind taking a sustainable food system approach. So what we required as our first credit was that they integrate a sustainable food policy and plan. And the intent there was to really create, promote, and implement practical sustainable food purchasing policies. And so I put here an example of Catholic Healthcare West, a leading Catholic hospital system, which has a policy. And so we, as a requirement for this, would accept the Healthy Food and Healthcare Pledge, or an independent vision or policy that a hospital would have adopted. But key to this, key to the credit requirement, was the recognition by that institution that healthy food or good food has a variety of components. So in the case of the good food approach, healthy, green, fair, and affordable. And so that's really a foundational framework for thinking about the institutional approach that these Green Guide food credits represent. So moving along, of course, nutrition and health systems is important, but it's important, of course, for all consumers of food. But what we wanted to do was to require, and we have here food service credit 1.2, a credit which provides the sustainable food system as a foundation, and on top of that we put nutrition requirements. So there'd be no points given or points gained by an institution if they strictly adopted some of these nutritional requirements, which, as you can see from the examples here, are focused more on a hospital foods, hospital consumers, but I think also apply to many other consumers. But again, has to be based on a foundational approach of a good food approach. So I will move to the next slide. Yeah, here are some examples of the types of nutritional changes we are hoping to see in institutions. Food, wholesome food made from whole foods, meat-free options, fried food elimination, and so forth. And I'm not going to really go into the details of all of these credits. Today I think what I'm trying to do is really provide an overview of these Green Guide credits and hopefully provide some thinking about how other institutional sectors can perhaps adopt these. The credit number 2 that I have on the screen right now is related to education and promotion of sustainable food, or again, or good food. And so the idea there was that many employees come into food service and leave food service, and the challenge is that they may not necessarily understand why their food service operations are doing what they're doing. So the idea was upon hire and annually that there's be some education provided to the employees in the food service department, and one more broadly to other institutional employees about why and what that institution is doing around local, sustainable, healthy, good food. So what we're trying to do is provide an entire institutional culture and understanding of good food. So associated with this credit are to inform patients or employees. This could be targeted events, and so again, you can imagine in a university setting or college setting the types of education that might be performed or put in place in the cafeteria. From the standpoint of procurement, credit 3 is really the sort of the nexus of the credits, and it's rather complicated. But I wanted to provide a quick little overview of how we establish the credit goals. And what we're saying is that, and again, this is where we had a lot of challenge because we had hospitals who were slowly understanding what sustainable or good food might mean, but there's really no objective criteria in the marketplace that we recognize other than eco-labels. And at the same time, we also recognize there's an interest in supporting the local food systems where they may not have organic or other certified foods in place. And so what we decided to do was to require a combination of eco-labeled food and or certain label claims allowed by USDA, and or local food is defined by a specific radius. And you know, my guess is that there's some who might debate whether the criteria is appropriately strong, or they might suggest that it's too strong. But I think what it does is, again, it provides something, a baseline, because in institutional food, at a minimum in healthcare, there was no criteria that could be measured and benchmarked against, and that's why our hospitals were excited by this. And we now have facilities around the country who are up at 25% of meeting these credit goals. I'm going to move through this slide. Well, I think I'm going to move through this slide. Oh, it's one of these. Here are some of the label claims, sourcing strategies, and these are all provided in the credits. We have a credit 4.4 that looks at bottled water elimination, and the intent there was to get institutional procurers and consumers understanding that water is really a something that is owned by belongs in the commons and is owned in community, and so it was to to refocus people in thinking about public water supplies and the value of public and access to public water supplies. So how do we encourage access to public water, while of course the elimination of plastics and containers and so forth is obviously good from an environmental perspective. It was really focused on thinking of the right to water and water as a common and in the commons. Finally, we have a credit 5, which is around hospital-supported linkages. So we really wanted to have our institution, the hospitals, thinking about how they can support, or in what we call hospital-supported agriculture, how they can support local urban organizations, whether it's CSA programs, whether it's supporting an off-site or hospital-owned food-producing gardens or farms, coordinating with some local farms to match planting decisions with purchasing intentions, and helping with season extension or processing, so buying hoop houses and so forth, as an example. So again, really thinking of the institution as a key lever in supporting the local agricultural community. So this really extends beyond a strict procurement approach to the institution. Of course, institutions create a fair bit of waste from food waste and composting, and these are kind of, I guess I would say, a give me, if you will, when you're thinking about institutional food. But of course, there are many cities, majority of cities around the country do not even have institutional food composting requirements. So again, this was to help provide some guidance, but as well to help develop the institutions, in this case hospitals, as drivers within their communities, drivers for changes to policy to help promote institutional and over time citywide residential composting, is for the variety of reasons that composting makes sense, which of course we don't have much time to go into. So I have a limited time left here. I just wanted to provide you some resources. There's a tremendous toolkit which is oriented towards healthcare institutions, a variety of educational resources available at the Healthy Food and Healthcare website. My organization, Institute for a Sustainable Future, isfusa.org, has some good materials. But I guess I just wanted to put it out there that I guess my experience in working with institutional procurement, I look at this through the lens of institution, and I think of folks involved in Real Food Challenge or School Food Focus or Farm to School movement. And though these credits were designed with healthcare in mind, they're easily applicable to other institutional settings. And so hopefully they provide a means for other institutional sectors to interested in benchmarking and measuring to perhaps not start from ground zero, but to start with a framework that may be adapted or maybe just easily borrowed. So I'm going to close there and thank you for your attention. And now have sort of the pleasure to introduce my colleague Nicole, who I've gotten to know over the years in her work in driving a leading example in the country around good food procurement in healthcare institutions. Nicole is a registered dietitian and the Sustainable Food Programs Coordinator for the Food and Nutrition Department of Oregon Health and Science University. She's recently developed the Sustainable Food Systems 5-year strategic plan for food and nutrition, and that's what she's going to share today. And she manages waste reduction programming, coordinates a hospital's farmers market, and she serves on several work groups, including the Healthy Eating at Farmers Market group, where market managers from the region look at ways to increase access to healthy eating for low-income patrons. The Healthy Food and Healthcare group, where several hospital food service directors, chefs, and dietitians collaborate to increase procurement of sustainably produced foods within the healthcare setting. And the Hunger and Environmental Nutrition Dietetics Practice group, where dietitians work on developing materials that educate healthcare professionals on the link between food and climate change. And some of her work outside the hospital has included working with the Portland Multnomah Food Policy Council, where she developed a fruit nut tree policy to encourage the planting of food bearing trees within city limits. So I'm very pleased to introduce Nicole, and we are blessed as a good food community to have her involved in this work, because she is just dynamite. So thank you, and here's Nicole.
Thanks, Jamie. Excellent. All right then. Well, welcome everybody. I am attempting to take control here. Okay. Let's see. There we go. All right. So what I'm going to discuss is a case study, essentially, of what OHSU has been doing over the last several years in regards to sustainability. And my hope is to help make the Green Guide to Healthcare, to see how I've put it into action and to make it practical and usable. So to give you a little context, just to start, we are a hospital and a university. We have approximately 542 beds and 1,250 patient meals per day, 8,000 retail transactions per day. So we have around 10 different retail operations up on the hill. This is an entire campus, and there are 12,000 employees. We do have a budget of about $8 million just for our food budget, and $12 million in retail and catering sales. And we've been self-op, so we do all of our own cooking and all that. Back in 2007, we did sign the Healthy Food and Healthcare Pledge. So we took the dive in and put this to good use in the respect that it oriented our managers as to the intent of working with healthcare without harm and the intent of creating a sustainable food system within the hospital. However, that was just the beginning. So since then, we've done a lot of work, and I feel like the work with Healthcare Without Harm has really evolved over time. So I would say that it started off by Healthcare Without Harm approaching us and saying, we'd like to work with you, we'd like to work on sustainability with you, how can we help? And so we started working with them, and then they started bringing together a bunch of the hospitals in the region. And that was really helpful because oftentimes institutions like ours tend to be competitive, especially food service. We're all trying to one-up each other, and what helped was actually bringing us together to have discussions so that we could talk about, well, how can we work together? How can we leverage our dollars together? How can we potentially become a demand together so that suppliers could feel like there was more of a demand that was committed? And so that's what we've been doing over the last several years. So then we brought in some of the suppliers to the table, and we had those conversations with the farmers. And then we brought in, over time, the distributors. And so now we have conversations ongoing. I feel like the lines are a lot more open between the suppliers and the distributors and us. And we can even ask our distributors, can you take on this particular local farmer? We're interested in a certain product. There's more of a conversation. And recently what's happened is Healthcare Without Harm has developed, after years of this work, has finally developed some tools that we can start tracking our purchases. So all the changes that we've made, we've been doing over years, but it's been hard to actually track and quantify what it is we're doing. So now they've developed some of those tools, and I'm going to present some of those. So in the beginning, I think it's really important that as an institution, we ask, what do our people who are here, who are serving, what are they interested in? And we did a sustainability survey back in 2010. It was about 15 questions long. And one of the questions that we asked was, what is important to you about the food you consume? And we had about 793 people that answered our survey. And looking at the statistics, about 473 people said that they didn't want antibiotics and hormones in their food. They obviously wanted it to be affordable. They wanted the animals to be protected and have humane treatment, and fair trade was important. And then as far as produce was concerned, no chemicals was an important factor. So taking these things, based on the fact that we're a hospital, we wanted to focus on health. However, we also wanted to make sure that we were satisfying our customer needs. So how did we establish what we were going to do? There are so many elements of sustainability that we could tackle, and the Green Guide to Healthcare definitely gave us really good format and structure upon which to build our operation, our sustainable operation. So where did we look? We looked at the Green Guide to Healthcare. I looked at the Sustainable Food Procurement Policy website, and all of these actually are links in the PowerPoint, but I couldn't put them up, so I actually have them in my notes. And if anybody wants them, I'm happy to share them. And Jamie also put up some links at the end there, so those are some great resources.
And we can post links when on the next to the recording, the archived recording for this.
Great. Okay, wonderful. Thank you. So yeah, we also looked at the USDA dietary guidelines. I mean, we are a nutrition-based department. Nonprofits, Food Roots is a great resource, and the Leopold Center for Sustainable Agriculture is a great resource. So this should look familiar now. These are the food service credits within the Green Guide to Healthcare, and it really served as an amazing outline for our sustainability policy. What I'm actually going to call it a strategic plan, because that's what we ended up developing. The policy will probably only be about a page or two long, and that will be formally adopted and has not been adopted yet. But the strategic plan it's long. It's about 60 pages long. So we've turned these 8 credits into about a 60-page strategic plan. Who, what, how, and who. So I wanted to make sure that everybody was involved in the creation of the strategic plan. So I developed a Sustainability Policy Steering Committee within the leadership team of our department, and that consists of about 20 different people that would come and sit in on the various elements of the strategic plan that we were developing. And we wanted to make sure together which goals fit our operation, because some of the goals that are in the GGHC might not necessarily fit our operation perfectly. And then how do we get there in 5 years? I figured 5 years was a good timeline for us to try to tackle some of these benchmarks. And then we created an action plan where we assigned people to the different action steps and a timeline. And that timeline is actually going to be enacted starting this next fiscal year in July of 2011. So just to give you a sense of how we took the GGHC and we actually turned it into a strategic plan, I'm going to do 2 credits. And I'm going to show you how we did that. So the nutrition credit in the GGHC is 1.2. And so you've seen some of this already. Jamie showed you. You know, there's nutrition-based benchmarks like getting rid of trans fats and getting rid of fried food and looking at nanotech and all that. What we did was we turned, this is what my plan looks like. So we turned it in, we called it charts. We took the credit and we turned it into a nutrition chart. And as you can see on the left-hand side over here, each category, we just we separated each category. So we have a GMO line, we have a trans fat line, and then from there we said, well, what's reasonable for us? And what was reasonable for us was actually, given the hospital setting, we wanted to make sure that we were basing all of our actions on evidence. And so for us, the nutrition was actually one of the most challenging credits, because there are a lot of things that are really controversial, such as GMOs. And in our world, of the dietetic world, we want to make sure that we are not eliminating an option that's actually beneficial, and yet you know, still arguing for the fact that we want transparency and information. And so what we decided for the first year was to review the research to determine the benefits and harms of GMOs. And this way, we have it online and you know, in documentation what the pros and cons are of each of these different categories. And I'd say some of the most controversial ones were GMO and nanotech, because they're just so new and there's not a whole lot of evidence-based research out there. However, I think personally it's really important for us to review that. And so from there, you know, we wanted to develop in 2 to 3 years, develop a template to maybe talk, you know, ask our distributors to make sure that they are being transparent about which products have GMOs in them. And so some of these categories aren't necessarily filled in. Like, we don't necessarily have anything for 4 to 5 years out, because that will be based on what we find in the first year. So we went through and did that kind of tracking 1 year, 2 to 3 year, and then 4 to 5 year for every credit. So credit 3 in the GGHC, as Jamie mentioned, was achieve a minimum percentage. There were actually a few elements to it, but one of them was achieve a minimum percentage of 15 to 25 to 50% of annual combined food and beverage purchases for any combination of the following sources. And then he talked about the third-party certifications and the label claims. And these are really important because they're enforceable. And there's a lot of there are a lot of labels out there that have no meaning. The word natural has no significant meaning as far as enforceable law. And so the label claims that are put out by the USDA and FDA are enforceable, and third-party certifications are enforceable. And I just wanted to show you real quick, this is what it looks like in our plan, once again. So what we did was we took, I mean, there are a lot of different categories of food. So what we did was we took each food category, like poultry, eggs, dairy, fruits and vegetables, grains, and we blew it out. And we said, okay, now for each one of these categories, what do we want to do? What's our 1-year plan, our 2 to 3-year plan, and our 4 to 5-year plan? And so as you can see, in the first category is poultry. We said consider any options where the increase in cost, as I know this is tiny writing, but bear with me, the increase in cost is less than or equal to 15%. So in other words, if our cost isn't going to go up more than 15%, let's really consider what our option is there. And then there are so many actions that we took for each category. So I got very specific because I felt like otherwise it wasn't really very practical. I mean, it's an enormous project to try to quantify some of this stuff. So to break it down into the smallest quantity, I think is going to be easiest to track. This is a great, Jamie kind of skipped over this next slide. This is a great resource. It basically goes through each of the third-party certifications and shows you which ones are applicable in which categories. So in other words, like, you're not going to get bird-friendly for, looks like wine or eggs necessarily. But what is important, you know, organic is relevant to all of them. And this just helps you figure out when you're making your goals, what goals are actually relevant and real. Same thing with the FDA-USDA label resource. So these are the label claims that are actually important and meaningful. The other ones that you see out there are not. So our sustainable procurement priorities. Now, this is another piece. So when we're creating our priorities, we had to figure out what's important to us. You're going to have to figure out, as an institution, what's important to you. So we're a hospital. What we decided was that human health was our first priority, do no harm. So we had to look at the things that would actually do harm to the human health system. Our second priority was to optimize health and do no harm to the environment. So in other words, we looked at the major and the minor health issues for each of those categories that I talked about in Credit 3. And in poultry, what we decided was, in poultry and pork, we looked at the major health issue, which was antibiotic usage, overusage of antibiotics, and also arsenic found in poultry feed. And what you'll notice if you look down here, this is our highlighted minimum priority. This is our minimum action that we want to take as far as poultry goes. So when we're looking at the 5-year plan, at the very minimum, we want to make sure that in 5 years we're buying poultry that has no added antibiotics. It would be great if we could buy certified humane raised and handled and so on, but we can't necessarily get through, we can't necessarily afford to buy organic or Food Alliance, but we can really focus at least, on the very least, no antibiotics added. So that's how we defined our priorities. And then this is the action plan. So we took, what I did was we took the first line, the first column, the 12-month objective, and we blew it out into an action plan. So we'll do this every year. We'll just take that 1 year, and then we'll probably have to break up 2 to 3 year and 4 to 5 year. We'll sort of swap over the plan and break out the second year for the 2012 action plan. So this is the 2011 action plan, and you can see in the left-hand column there's the various elements of the credits, and then in the second column is sort of an overall objective. The third column is the action steps, which is from that first column in the strategic plan. And then the fourth column is who's going to be responsible. And I made sure to number each one of these things consecutively so that everybody knew exactly what they were responsible for, and then a timeline. So this is hopefully going to help guide everybody in our leadership team over the next few years on exactly what tasks they need to take each year. And then as far as tracking goes, this is a sustainable food procurement tracking tool that Healthcare Without Harm just recently developed and put up on their website. And it's going to be extremely helpful for us because basically what it does, I wish it was a little bigger, it helps us break out, okay, we bought this, now what was the label on this, what was the sustainability element of this thing, and how much did we spend on it? And then we can start tracking over the course of the years, every quarter, what our procurement is. And then that will help us decide if we've reached that 15, 25, or 50% goal. And it's also just really helpful for us to be able to do PR. It's really helpful for us to write articles to get the word out about what we're doing, and also work in collaboration with other hospitals and say, jointly in this region, we've spent X amount of dollars in the local economy, or X amount of dollars on organic, or X amount of dollars. So I think that that's a really good tool and sort of statistic to have in our pocket. So just real quickly, I wanted to go over some of the other elements of what we're doing at OHSU that really make our sustainability effort exciting. We have a farmer's market. We have a natural food store called It's All Good, and I'll explain a little bit more about these things in a moment. We have some interesting retail purchasing. We have a garden that we started. We are composting. We buy compostable food service ware. We just switched over our chemical supplier to be a more green supplier, and we occasionally do legislation and letter writing. So the farmers market is really exciting. It's going into its 5th year. We have new standards this year. I run the farmers market, and so fortunately I have the ability to create standards that I really hope to be able to stick to. But some of the interesting ones that are relevant to the GGHC are, for instance, I'm not allowing plastic bottled water there this year. I'm not allowing high fructose corn syrup containing beverages at the prepared food stands. All of the meat that we are growing, or that we are selling fresh or frozen, is grown without added antibiotics or hormones. And all of the produce that we're making available is going to be grown without pesticides and herbicides. So it's really creating standards that I really hope to be able to stick to. It's definitely a good challenge. This market serves about 33,000 people each year, so it's about 1,600 to 2,000 people that show up every week. And we also have a market basket program where when people can't get to the market, they can come and pick up a basket that they pre-order. So that's really exciting, and that's all online. And we also make sure that we accept all of the federal programs that make fresh local foods accessible to low-income folks. So we have a nutrition incentive program that we got a grant for, where we match dollar for dollar up to $5 per day per food stamps card, and people can get basically free money to shop at the market. And there's also a WIC program where we accept WIC vouchers, and a senior farm direct nutrition program. And we estimated last year, and conservatively, that we contributed about $165,000 to the local economy. There's the market basket program. The It's All Good store is our very small but very profitable little store on the 9th floor of the South Hospital, and we have standards for what we purchase and what we sell in that store. And basically, we have gluten-free offerings. We have GMO. Everything is GMO-free, high fructose corn syrup-free, RBGH-free. That's bovine growth hormone-free in our dairy. And we actually started selling a bunch of the farmers market goods there. So we sell frozen, grass-fed, coastal meat in the freezer, and we sell the jams and nuts from some of our farmers. So slowly we integrate more and more local items. And there's some retail foods that we purchase that are sustainably grown. And we have a very exciting meat program where we just started buying grass-fed Carmen Ranch beef. It's out in Wallowa, Oregon. And we're buying about, as of June, we're going to start buying about 40 heads of cattle each month. And this basically, it's going to serve about 50% of our beef procurement, which is incredibly exciting. And we're finally getting the word out that we're doing this. We have a garden that we started, and that's just really exciting, where all the donations go to Ronald McDonald House, so they are going to get some fresh berries and fruits and vegetables. And we also do composting. So we composted, I think it's an estimate of about 570 tons last year. It's a huge amount. It's about 100,000 pounds per month. So we do it both in the back of the house and in the front of the house. and that's closing the food system loop. You can see there on the left-hand side there's some compostable food serviceware that we've been purchasing. All of our stuff goes to Cedar Grove, which is the picture on the right. So we have to make sure that everything that we procure is actually compostable at Cedar Grove, not just biodegradable, but actually compostable at Cedar Grove. And then we basically support policies when they come out. You know, I ask my director, and we make sure that we're comfortable supporting these policies, but we're really trying to sign on to as much sustainability effort as we possibly can. So I just wanted to reiterate that institutions such as OHSU, and probably some of yours out there, have a great deal of leverage to help shape industry standards. And we are raising the bar to help create a brighter, more sustainable future for all. And I would really invite you to join us, because together it is much easier. And there are some resources for you. And that's it. Thank you very much for your time, and I'm happy to answer questions.
Great. Thank you, Jamie and Nicole, for great presentations today. Now I'd like to introduce our next presenter, Joe Cross of Reboot Your Life. Joe is a social entrepreneur. He's been a successful businessman for many years. He lives in Sydney and New York, which attributes to his success, I guess tells us of his success. But the unique and interesting thing about Joe is he gives back. He's been involved in a number of social enterprises, most recently founder of Reboot Your Life. The Reboot Your Life team actually found us on an NGFN webinar and asked us to partner with them. Their purpose is increasing the consumption of healthy fruits and vegetables in Americans' diets. Joe had a transformation himself with moving from unhealthy foods to healthy foods, and he'll share more about that. He has a website, rebootyourlife.org, and many interesting things going on. He's in screenings right now around the country showing a documentary that's part of the program, and getting a lot of positive response from healthcare providers, from schools, from Americans all over the country. So with that, Joe, I'll let you take it from here.
Thank you, May. G'day, welcome everybody. As you can tell, I've got the Australian accent, so I hope you can understand me, and some of my twangs aren't too bad. I'm coming at this discussion. It was great hearing the two previous presenters, and they're coming from a very academic point of view, and my point of view is a first-hand experience one. And as Marty said, I'm an entrepreneur, and entrepreneurs tend to try and solve problems. And in my view, the biggest problem we have in America and Australia and most of the Western world is the health of the people. And it's, you know, you don't need me to tell you how big a problem this is, with over 1 billion adults worldwide overweight and 300 million obese. You know, and the thing that we're going to talk about is I was one of those people, and I was in that camp. I had spent basically the first 40 years of my life trying to kill myself with food. And I say this quite often, I'm now spending the next 40 years of my life trying to stay alive. And I think that encompasses so many people in the world today. And just in the US alone, the numbers are frightening from a percentages point of view, and they're getting worse. And as you can see there, the costs, $344 billion by 2018, and that's 21% of the nation's healthcare spending. And some of these numbers don't even include, for example, knee replacements. My father's an orthopedic surgeon back in Australia, and he estimates that 3/4 of the knee replacements he does are because of people being overweight, and those numbers don't even reach into these forecasts. So it's a mammoth, monstrous problem. And so the main reason, if you think about, I've spoken to some of the world's experts in the last 4 years while I've been on this crusade to save myself and then to try and inspire others, is that what I have found is that 70% of all disease in the world is caused by lifestyle choices. And lifestyle choices include what we drink, what we eat, what we smoke, and our exercise, but a big portion of that is what we eat. And hence our partnership with the National Good Food Network that is very much in the supply side. I've sort of coming at this from my job, or the job of Reboot is to create demand. And so if we get into what I think I sort of believe that telling people what to do doesn't work. I wish it did in some respects, and I think we're sick and tired of being told what to do, whether it's our parents, our kids, our boyfriend, our girlfriend, our husband, wife, our boss, our government. And it's more about inspiration and standing up and being a part of doing something yourself and being a leader. And so what we're trying to do here is that build awareness of the benefits of fruits and vegetables, provide the tools and information to help increase that consumption, and then to provide a community and support to facilitate that change. We are not alone, and to try and do this, to make this change, we need your support, your help, because everyone here today can tell people about this message. So what I've done is I've launched a film called Fat, Sick and Nearly Dead. The title is effectively where I found myself at age 40 after 8 years of taking medication night and day for an illness and 310 pounds. And I had effectively turned my back on Mother Nature, and I said, what would happen if I run towards her in full ball? What will happen if I just eat a plant-based diet? And in order to make the movie interesting, I thought, what if I drink it? So for the first 60 days, I drank only vegetables and juice, vegetables and fruit. I juiced them up. I got a truck, an SUV. I started in New York. I loaded up the truck with fruits and vegetables and a battery, and I drove across the country, and I interviewed hundreds and hundreds of people, and I listened to what they had to say. And my grandmother told me, Joe, you got 2 ears and 1 mouth. You should listen twice as much as you talk. So I did a lot of listening, and what I heard was quite extraordinary, and that's in my film. And when you go to jointhereboot.com or fatsickandnearlydead.com, you can see more about that, and we have a trailer up on YouTube, and there's lots there. I guess that the point that I want to touch on most that I heard out there was that people are prepared to take responsibility for their position. There wasn't one person I met out there that was sort of blaming anybody else for their own predicament. And while, yes, they had their beefs about certain things, their main issue was that they were looking for information and they needed tools and they wanted support and community. And so I kind of did like a bit of a Forrest Gump thing. I think everyone knows the Forrest Gump story when he ran across America and people started to follow. I was interested to see if anybody would follow me. And a truck driver from Winslow, Arizona, I believe, walked through the door for Middle America, a 430-pound monster of a man who was living in the back of his truck on absolute minimum wage, and he called out for help. And I came in. I didn't provide him and stick with him like they do in The Biggest Loser. I said, look, here's what I did. I'll show you what I've done. And he passed it on. I passed it on to him, and he passed it on to others. So what we are very much about is providing examples and setting the example of increasing the consumption of fruits and vegetables. So by the Reboot Your Life site, and this all came about, I mean, I really had, making the movie was a little bit selfish in a way. I tried to do this to help myself after being on medication for so long, and I didn't want to go down that path. And it took me 5 months before I was medication-free, and that was 3.5 years ago, and I haven't had a pill since. I've had absolutely nothing, and no Advils, no nothing. And I'm still down about 80 pounds from the 310, so I'm sitting at around sort of 230 and very healthy and feeling very much alive. That people started to ask me, Joe, what have you done? And I want to do this. And it became quite interesting in that people, when they can see a solution, and I'm not suggesting this is the solution, but a solution, was that when you see someone being successful at looking good, getting off medication, losing weight, being positive, it becomes quite addictive. And so our movie has received incredible reviews. It's won awards. It's only been launched for 3 weeks, and already we've had thousands of people sign up and join the Reboot. I think it's up over 5,000 now that people have signed up. And on our Facebook page, people are out there and they're supporting each other, and they are doing a reboot. And a reboot consists of going online, finding out which plan works for you, and committing to only eating fruits and vegetables. Now, I get asked a lot about should it be organic or conventional, and because I'm going to a mass market and I'm going out there to everybody, I'm sort of not interested in getting into that debate just yet. I'm sort of taking this as 101, if the average consumption of fruits and vegetables in our country is 5% of caloric intake, with things like 600, so 60% being processed food, 30% being animal product, and 5% whole grains and white potatoes, I'm interested in how do we take that 5% number and push it to 10? So by providing customised programs, nutritional support, and a daily meal plan and community tools all for free, I'm hoping to build that support, build that community, and enable this area where we are so connected in the world, yet so many people feel alone in this problem. So it would be a monumental effort to take our consumption from 5 to 10, which is doubling it. But when I get up and talk in front of people, I say, but you know what? At the end of the day, it still leaves 90% of the calories you can eat for your pizza on the weekend and your hot dog at the baseball game. So I'm not wanting to take away from them their life. So I'm really wanting to come at this from not telling people what not to eat, but to inspire them to eat more fruits and vegetables. And so I know that from personal experience, fruits and vegetables really have improved my life, or saved my life. Without them, I was sick. With them, I am healthy. And given that there's so much sickness out there, there's so much pain associated with that, and actually getting people to understand this, to see it firsthand, particularly with the power of social media, that's what we're about. And we've only just got started, and people like you that are listening can help. You can go and have a look at the film trailer. There's a 5-minute extended version on YouTube. You can go to jointhereboot.com. You can contact me and Marty, and we can answer any questions. We are out there. I'm working very hard. I had a meeting. I'm in Los Angeles today. I was on the doctors yesterday. You'll be hearing a lot more about us and what we're doing, and we're super excited about it. But for us, it's very much about community. It's very much about providing the information, and it's about getting the tools and sending a positive message.
Well, thank you, Joe. Thank you. And now I'd like to open up the floor to your questions. Remember, use that questions box in the control panel. There have been some questions sent in already. Also, you'll notice that ECOL has been answering some of your questions directly in the text. That'll also show up in the questions box. So, Jamie, let me start with a question for you. And if you will do me a favor as moderator and tell me if you want to direct the question to a particular person, please indicate that. There is a question from Erica on incentive. What do hospitals or other institutions get out of adopting the Green Guide for Healthcare? Why would they do it?
Well, I think, ECOL can speak to that, but I think there's quite a number of institutions out there that are interested in supporting good food. And the credits provide a way to metric and benchmark. So it's not necessarily that they'll get, at this point, there's no rewards, there's no, green, silver, platinum award or anything like that. It's self-certifying, it's a voluntary metric. The original Green Guide for Healthcare construction credits have just recently been adopted by the U.S. Green Building Council as sort of the U.S. As a lead for healthcare, if you're familiar with that system. So there's a potential for the Green Guide to be incorporated into some sort of third-party rating system. But at this point, the institutions we're working with I think are looking for a tool because up to then there was no criteria for them to move forward on, and they want to make change. And so the tool fills a need that they're looking for.
Okay. There may be, I can imagine there's some resistance to beginning a program, but ECOL, do you find that once people have the natural food store or the farmer's market, do you see once it's established there's staff enthusiasm?
Oh yeah, I think that there was a lot of skepticism around one, opening the farmers market, opening the natural food store, making any purchases that were going to cost. We might foresee a large budget increase, but how it's turned out is that, for example, the farmers market. I mean, it's become. We just started a blog, and it was when I put out the gearing up for the 2011 farmers market. The web strategies guy came into my office and said, "You were the largest hit of all the blogs yet." And something like that's really exciting. It means many people are tracking and following, and I get a lot of positive feedback, and it's a morale booster. And all of this ends up being a morale booster for the employees here. And then for something like the It's All Good store, I think there was a lot of skepticism, but in that very small space, we've managed to create quite a profit. And then in as far as some of our other purchasing goes, we thought maybe it would be really expensive to switch over to this grass-fed beef. I mean, this is amazing beef, but as it turns out, our purchaser was able to finagle some numbers with some other products, get some of the costs down. But then what we found was by purchasing the whole cow, instead of purchasing just, let's say, the tenderloin, which is a really expensive cut, but then we also have the ground meat, which is much less expensive. When we buy the whole cow, they give us a flat per pound rate, and so it ends up really balancing out. And we work directly with the farmer, and so it's just there are ways to create affordable changes, but it definitely takes some creativity.
Yeah, the constant problem is paying the true cost of food. Ottavio mentions that institutions and farmers need to work together to make sure that the true cost of food is paid to the farmer. Are you able to communicate with producers directly to say, here's our planning, we'll need this many pounds of carrots, sort of, in other words, taking a value chain approach?
Mm-hmm. Yeah, actually, we did do that for many years with one particular. Actually, there are several farmers that we do it with directly. We do purchase quite a bit through our mainline distributors. Obviously, hospitals are on contract, and but when you specify and your primary distributor doesn't necessarily have what it is you're specifying for, you can buy off contract. And so we have done quite a bit of buying off contract, and we have actually not only that, but we've done direct. So we have one farmer that we work with. We've done production planning for several years, and unfortunately he passed away last year. So we're still waiting to fill that niche. And but we still buy. We have another lamb farmer regionally that we buy from, and we always work with him directly on how much we're going to need for the year. And then what we've recently done is we're checking into, well, if we wanted to buy organic from a particular or a particular set of items, how much could we potentially work with a distributor and have a contract around, would you give us a deal if we bought XYZ organic? And so there's ways of making deals, and definitely working ahead of time with direct farmers, yes.
Mm-hmm. There's a question from Emma for you, Ecole. She's asking about the education that you do with your chefs and food service workers. Where did the curriculum come from?
Where did the curriculum for?
One of the Green Guide criteria is educating staff.
Mm-hmm.
And in terms of implementing that program, are you doing work on that one? And if you are there materials? And maybe, Jamie, about materials that would be available?
Yeah, well, I'm a dietitian by trade, and so my nature is to do fact checks and put plans together and put educational sheets together. And so what I've done is I have a PowerPoint that's an in-service. So whenever anybody is hired, they go through a series of in-services to become trained to work in our department. And one of the in-services is a sustainability and waste reduction in-service. And so we just created that PowerPoint relevant to whatever it is we're doing in our department, and so that people can know what's important, what our efforts are, what are their, how does their job play into our efforts, and just making sure they're on board. So yeah, I do have an in-service that I put together, but that's from the myriad of resources that are out there, including Healthcare Without Harms, all their myth-busting pages and their fact sheets, and all of Leopold's Center and Food Roots, that you gather resources over time.
Mm-hmm. Mm-hmm. Other than this webinar, Nicole, are you doing any sort of direct mentorship so the idea can spread? You're obviously put a lot of thought into this, and Jamie, from the Healthcare Without Harm side, the Green Guide side, are there places where people can get a face-to-face mentorship?
Well, I'll say my part real quick. I feel like Healthcare Without Harm has been leading the way in that spreading the good gospel, the good food gospel across the country. They will take some of the work that I've done and put up like a template of it, so that other people can use it. That's the hope, is that lots of people can use this work. Yeah. So Jamie, what do you have to say about that?
Yeah, so there are hospitals doing presentations like the one Nicole has around the country, and we're also learning from college campuses and universities as well. So there are other opportunities. I think the one-on-one gets challenging from a resource time perspective, but within the Healthy Food and Healthcare Network, there are conferences and regional events that I would suggest people go to healthyfoodandhealthcare.org to look at, and/or there's a variety of webinars where there have been other presenters similar to Nicole sharing similar examples. And there's a FoodMed conference coming up where many of these similar examples will be shared. And I know School Food Focus has an event coming up. And so I think the more this work gets incorporated into institutional purchasing, the more mentors we have, if you will, to share the message. I think what's important about the Green Guide, again, is that it provides a framework. I will fully admit it may not, there may be pieces to it which could be changed and aren't perfect, but at a minimum it's sort of a foundational framework for other institutions interested in moving supply chains and so forth. So to the degree that other institutions can work with healthcare on sort of shared credit language, shared asks to the supply chain, I think we're all collectively better off.
I do want to point out that in the post-webinar survey, there is a checkbox if you'd like your contact information sent to our presenters so that they can contact you. So I'm sure they can work with you to find a mentor if you're having difficulty. Joe, a couple questions for you. One is, where do you see the Reboot program fitting into healthcare?
I think, Jeff, that what we're about doing is that I believe you can everyone can ask themselves the question, am I on track or off track? When people ask themselves that question, if the answer is I'm on track, well, then they're going along pretty good, then, that's great. If people are off track, I feel that what we can do at Reboot is help them go from that world of being off track to on track. There's a double whammy going on. When you eat lots of fruits and vegetables, you're getting a supercharge of phytochemicals, micronutrients, vitamins and minerals and all sorts of powerful stuff that helps and protects cells and health. But the big thing, the other side of that sword, is you're taking out so much of the processed food that I think most people on this call would recognize does go a long way to creating all sorts of problems in the depression, obesity. We could do a whole webinar on all the problems that are associated with just that. So the the first thing that by doing a reboot does is it sort of lifts the fog on people, and that this is not something that they can do all of their life, because this is a reboot. It's like, this is a time where you actually reset the system, reboot, and then when you come out of a reboot, you actually feel like eating more fruits and vegetables. So how will it affect the healthcare system, Jeff? If I was able to get as many, the more people I get to do a reboot, the more people that are going to then work out that possibly they are in that camp where 70% of disease is caused by lifestyle choices, and they'll be motivated themselves to do something about it. And I said it before, and I'll say it again, most of us know that these things are good for us. It's a difference between knowing it and doing it. And it's when you do it, that's the difference. And I mean, I spent 3 years making a film to create that ability for people to do it. So it's very difficult in a talk without seeing the content of the film to actually see how it actually inspires and educates people. And also, because a film has to entertain.
And if I wanted to find out where a film was showing in my area, where would I go?
Well, what we decided to do with this was, because we're only a small independent company, we put the film out on iTunes. It's out on Amazon. You can buy the DVD, which has an extra hour of special features and interviews with experts and all sorts of stuff about extra content. You can buy that from our own website at fatsickandnewlydead.com. It's in Whole Foods, and we are, as I said, starting out small, but where the word is out, and I think we'll just continue to build. I'm sure other people have heard of the movies like Food Inc. and Food Matters and these sorts of films. There's a whole host of filmmakers out there like myself that are creating this really valuable content to inspire people to lead a healthier life, and we're just part of that group, and very proud to be someone who's putting something on the table as part of the solution. And as I said earlier, trying to create the demand. I get asked this a lot, if we get 20 million people to see our film tomorrow, I don't think you'd be able to buy kale in the country. I also think that if we got 20 million people to go into McDonald's tomorrow and ask for a green kale juice with some cucumber, celery, lettuce, ginger and lemon and kale, and we got them to do it the next day and the next day, next week, McDonald's will be selling this. So they're in the business of making money. So I really see my job as creating demand.
Well, we are out of time, so I want to thank you, Jamie, Cole, and Joe. You cannot leave this webinar today without feeling inspired by the great work that our panelists are doing. I do want to let you know that the webinar is recorded, and it'll be archived on our site along with the more than 24 other webinars we've done in the past. We've grouped the webinars into topics such as aggregation and distribution, farm to school, and many more. Of course, several of our webinars cover many of these topics, and they are appropriately cross-listed, and we hope you'll be able to find the webinar archives that'll be most helpful to you in your work. ngfn.org/webinars for all of this. We hope to have this up within a few business days. The NGFN webinars are the third Thursday each month at 3:30 p.m. Eastern Time. The sign-up links are on ngfn.org/webinars, same place for the archive. We are running a bonus webinar next, though, May 5th, featuring Orrin Hesterman and the Fair Food Network. A host of books and films in recent years have documented in great detail the dangers to our current food system, but advice on what to do about it largely begins and ends with the admonition to eat local or eat organic. This advice is not helpful if, as Chicago Congressman Bobby Rush once pointed out, you can buy ketchup where you live but no fresh tomatoes. Just as you can't impact the course of climate change simply by switching to CFL bulbs, you can't fix the broken food system by simply growing a backyard garden. It requires redesigning our food system. Enter Fair Food, an inspiring guide to change not only what we eat, but how our food is grown, packaged, delivered, marketed, and sold. And on May 19th, a food hub is a centrally located facility with a business management structure facilitating the aggregation, storage, processing, distribution, and or marketing of locally or regionally produced food and products. May 19th, the Wall Center, along with USDA and some of the most innovative food hub managers, will present all about what Deputy Secretary Kathleen Merrigan yesterday on her blog called Incredibly Innovative Business Models, specifically addressing some of our producers' most overwhelming challenges. Don't miss these upcoming webinars. There are links from ngfn.org/webinars for both of these. While I'm speaking of food hubs, if you are part of a food hub, please let us know. go to bit.ly/myfoodhub. There's a short series of questions. We just want to know that you exist. And if you know someone else who's involved in a food hub, please let them know about this questionnaire. There's a link on the front of the ngfn.org website as well. You can find the NGFN on YouTube, on Twitter, and our website, ngfn.org. I'd like to encourage you to add your name, interests, your bio, and other information to our growing database of people, organizations, and funders, increasing your ability to connect to people within your regions and nationally. This is a resource to find people in your region or across regions doing similar or complementary work. All part of the NGFN acting as connector. Look for the database link in the resources section of our site. And if you haven't already, sign up for our email updates. There's a link also on the ngfn.org homepage, or you can let us know in the post-webinar survey. We'll sign you up. Please contact us at any time. Email address is contact@ngfn.org. And this is it. The NGFN would like to thank you for your time again. Once again, let me encourage you to fill out the survey that will open in your web browser in just a moment. And this concludes the webinar. Have a wonderful day.